Let's chat about two types of diabetes medications, DPP-4 inhibitors and GLP-1 agonists. We will talk about four things: prices, how easy it is to take, side effects, and benefits. These drugs help manage blood sugar levels, but they work in different ways. Let's break it down in simple terms. In brief, GLP-1 medications are prohibitively expensive. Also, there have been some occasional shortages in the past due to its use as a weight loss drug. Before we dive in, see my video on 8 natural ways to reverse prediabetes up there. Even though it is about prediabetes, almost all 8 tips are suitable for any type 2 diabetics. Every medication has its good and bad sides. DPP-4 inhibitors, also called gliptins, are pills you take by mouth. They stop an enzyme called DPP-4 from breaking down hormones that control blood sugar. This helps your body make more insulin when you eat and reduces the amount of sugar your liver produces. GLP-1 agonists, on the other hand, are usually injections. They mimic a hormone in your body that makes you feel full and slows down digestion. This helps control blood sugar and can lead to weight loss. Now, let's talk about how easy they are to use. DPP-4 inhibitors are pretty simple. You just take a pill once or twice a day, with or without food. GLP-1 agonists are a bit trickier. Most are injections you give yourself daily or weekly. But there's one called Rybelsus that's a pill you take once a day. When it comes to price, DPP-4 inhibitors are generally cheaper. They can cost around $400 to $500 per month without insurance. Check the price in your country and also with your healthcare insurance provider. Around the same price, you may be able to get the SGLT2 type medication, which I consider as more beneficial. GLP-1 agonists are more expensive, ranging from $800 to $1,000 or more per month. But prices can vary a lot depending on your insurance and where you live, and whether there is any government assistance. Wait, there is more. But do not forget to hit the like button if you have found this video useful so far. Let's talk about side effects. DPP-4 inhibitors are usually pretty well tolerated. Some people might get a mild upset stomach, headache, or stuffy nose. These often go away after a couple of weeks. Rarely, some people might get a rash or joint pain. Some DPP-4 inhibitors may have an increased risk for incident heart failure. GLP-1 agonists can cause more noticeable side effects, especially when you first start taking them. The most common ones are nausea, vomiting, and diarrhea. These usually get better over time. Some people also feel less hungry, which can be good if you're trying to lose weight. Both types of drugs have a low risk of causing low blood sugar, especially when used alone. But the risk can increase if you take them with other diabetes medications. Now, let's look at the benefits. DPP-4 inhibitors can lower your A1C, which is a measure of your average blood sugar over the past few months, by about 0.6 to 0.7%. They don't usually cause weight gain, which is good. GLP-1 agonists are more powerful. They can lower A1C by about 0.8 to 1.6%. Plus, they often lead to weight loss. Many people lose about 1 to 3 kilograms, 2.2 to 6.6 pounds on average. Some newer GLP-1 agonists can even help with more significant weight loss, up to 15% of body weight in some cases. GLP-1 agonists have some extra benefits too. They can lower blood pressure and improve cholesterol levels. Some studies have shown they might also reduce the risk of heart problems in people with diabetes who have heart disease. DPP-4 inhibitors are generally safe for the heart, but they don't seem to have the same protective effects as GLP-1 agonists. One DPP-4 inhibitor, Saxenda, was found to slightly increase the risk of heart failure in some patients. Both types of drugs are usually used after metformin, which is the first choice for most people with type 2 diabetes. But if metformin doesn't work well enough or causes side effects, your doctor might suggest trying a DPP-4 inhibitor or a GLP-1 agonist. GLP-1 agonists are becoming more popular, especially for people who also need to lose weight. They're even being used to treat obesity in people without diabetes. But they're not for everyone. People with a history of pancreatitis or certain thyroid conditions should avoid them. DPP-4 inhibitors might be a better choice for people who can't tolerate the side effects of GLP-1 agonists, or who prefer taking a pill instead of giving themselves injections. They're also often used in combination with other diabetes medications. It's worth noting that researchers are always working on new diabetes drugs. In 2025, we might see some exciting developments. There's talk of new GLP-1 agonists that could be even more effective for weight loss. We might also see more oral GLP-1 options, which could make them easier to take. There's also a chance that these drugs might be approved for other health conditions. Some studies are looking at whether GLP-1 agonists could help with things like heart failure, liver disease, and even Alzheimer's disease. But we'll have to wait and see what the research shows. When it comes to choosing between a DPP-4 inhibitor and a GLP-1 agonist, It really depends on your individual situation. Your doctor will consider things like how much your blood sugar needs to come down, whether you need to lose weight, what other health conditions you have, and what side effects you can tolerate. Remember, these medications work best when combined with a healthy diet and regular exercise. See the video in the above link, cheaper alternative to Ozempic? That may be of interest to you too. They're not magic pills that let you eat whatever you want. You'll still need to watch what you eat, stay active, and monitor your blood sugar. It's also important to keep in touch with your doctor when you're on these medications. They'll want to check your blood sugar regularly to make sure the drugs are working well. They might need to adjust your dose or switch you to a different medication if you're not getting the results you need. If you're having trouble affording these medications, talk to your doctor or pharmacist. There might be patient assistance programs or generic options that could help lower the cost. Lastly, don't forget about the importance of lifestyle changes. While these medications can be really helpful, they work best when combined with healthy habits. Eating a balanced diet, getting regular exercise, managing stress, and getting enough sleep can all help control your blood sugar and improve your overall health. Living with diabetes can be challenging, but with the right treatment plan and support, many people are able to manage their condition well and live full, healthy lives. Whether you end up taking a DPP-4 inhibitor, a GLP-1 agonist, or another type of diabetes medication, the goal is to find what works best for you. See the comments for research references. See the video in the above link, Power of SGLT2 Inhibitors. They work on a different principle, and some of them found to be protecting the kidney and heart. So there you have it, a rundown on DPP-4 inhibitors and GLP-1 agonists. They're both useful tools in managing diabetes, but they work in different ways and have different pros and cons. Your doctor can help you figure out which one might be right for you. And remember, no matter what medication you're on, you're in charge of your health. Stay informed, ask questions, and work closely with your healthcare team to get the best results. Disclaimer: consult your healthcare professional before changing your medication or lifestyle. Do not forget to click the like button and subscribe. On the screen, you see a few videos related to some other diabetes-related issues. Thanks very much for watching this video. Subscribe to my channel. See you in the next video. None of the information provided by this video is a replacement for your physician's advice.